Hi, I am Dr. Brian Harris, a practicing dentist in Phoenix, Arizona. And today I want to share with you an expert tip on diagnosing and treating more cosmetic cases in your practice. So I heard once in a lecture somebody say this idea of like, stop telling patients what they need and start asking them what they want. And I thought that was great, and I started using that in my practice and got into a lot more deeper dialogue with my patients on what it is truly that they wanted. And then a couple years into that, I kind of realized something one day when I was showing somebody a preview of what their smile could look like. So I kind of changed that now, and what I often say is like, stop telling patients what they need and start showing them what's possible. So in doing so, when you can give people a preview or a cosmetic preview, it drastically changes the way they look at that treatment. You know, it's one thing to talk for 30 minutes about all the benefits of cosmetic dentistry, or you can just take that 30 minutes, do a quick, what I call a smile test drive, a motivational mock-up, whatever you call it, do that and let them walk out that day with that new smile. That's powerful. Then they get to go home and show their friends, show their family, show their spouse, and it makes that decision, you know, less of a logical decision and much more of like an emotional decision. And so that would be my advice to you today is use the motivational mock-up, use the smile test drive to show your patients what's possible. The number one material I've found to do that is Herculite Ultra Flow. So it's a cable curl product, it's a flowable composite. You use that with an Explorer, with normal stuff that you have at your office, with a slow speed handpiece and discs, and you place that material on the teeth. You lengthen laterals, you can rebuild worn down teeth, and show people it's possible, and then let them wear it home. And it'll be a game changer for you in your practice and how much case acceptance you get, because now people will be thinking more with their emotions and less with just the logic. So I hope that's helpful for you. Try it, practice on your team, do it as a team meeting idea, take 5 or 6 employees, practice, get some experience under your belt, and then start doing it live with patients.